Welcome to this morning's GNCC Espresso Live, a webinar series filled with information to help people and businesses find their way through these unprecedented times. These dialogues are made possible due to our partnership with TD, and we are very grateful to have them by our side again today.
Good morning. My name is Scott Galbraith, and I'm the District Vice President for TD Business Banking, covering the Niagara Peninsula. It is our continued pleasure to come to you as the sponsors of the GNCC Espresso series. It's our pleasure to continue to assist in providing valuable information to those of you in the business community and to continue supporting everyone through these uncertain times. We hope you enjoy the content of today's presentation. If you do have concerns or questions about banking or anything related to TD, certainly feel free to reach out to myself or Jennifer Monaco, whose information will be provided at the end of the presentation. Jen is the relationship manager for TD covering the peninsula. Thanks again to Mishka and everyone at the Chamber for the invitation to continue to participate, and we hope you enjoy the presentation. Thanks very much.
My name is Mishka Balsam, and I will be your moderator for the next hour. As we have just passed the 200-day mark of the COVID-19 pandemic, we are still in uncertain times, which, as many recent reports suggest, impacts all of us differently. And if we had questions many months back, we have equally or likely more of them at this time. At today's webinar, we are asking many of them and hopefully find many answers as well to important questions such as, what have we learned about the virus? What is the current knowledge about the spread? Where are we going? And something that is likely on everyone's mind, what is the way out of this? To address some of these questions, we are fortunate to be joined this morning by Dr. Karim Ali, who attended the Medical University in Karachi, Pakistan. He then went on to complete his internal medicine residency at Hennepin County Medical Center in Minneapolis, Minnesota, and his infectious disease fellowship at Creighton University and University of Nebraska Medical Center in Omaha, Nebraska. Dr. Ali joined Niagara Health 8 years ago and established the Division of Infectious Diseases. He currently serves as the director of the Division of Niagara Health. In addition, he's also the pandemic preparedness lead for the organization. Dr. Ali is also involved in multiple national clinics trials for COVID-19. He's assistant clinical professor in infectious diseases at McMaster University, and we're fortunate that he volunteers for Positive Living Niagara and the StreetWorks program. Dr. Ali, thank you very much for joining us this morning.
Thank you so much.
Thank you. Just a quick housekeeping on today's format. During the next 25 to 30 minutes, I'm going to pass the mic over to Dr. Ali, who's going to have a presentation for us. Following that, we are going to open up the mics and the chat function for any questions that you have. If you have, while you're listening to the presentation, any particular questions that you would like to ask, just utilize the chat function. We'll get to those questions at the end of it. We can see them here on our end, and we'll address them in about 25-minute times. We really are encouraging interactions, and we want to hear what you would like to ask, and we want to hear the answers at the same time. So at this time, I'm going to hand the webinar over to Dr. Ali. It's all yours.
Thank you so much for having me, and it's a privilege to be able to discuss and talk to you about this. I'm going to share my screen now. And I wanted to start just by prefacing this, that I am an infectious disease specialist in the hospital, and we will talk about over the next few minutes, we will talk about how, what the current understanding is as to how this virus originated and how it spread, and it has essentially changed the way we live now, okay? There are lots of things that still remain unknown of this still very new disease, and but I'll try my best to answer to the best of my ability. So I would just want to say, like, there are no relevant conflicts of interest that I have that I want to disclose right now. What I wanted to go over sort of as our um, um, introduction, we are going to talk about the current knowledge and spread of this. Where have we been? Where are we going? And what is going to be the way out of this now? So just to get this out of the way, COVID-19 is the disease, as we know, and pandemic is named COVID-19. And SARS-CoV-2, or severe acute respiratory syndrome coronavirus type 2, is actually the virus that causes this disease. For a lot of us around the world in infectious diseases and epidemiology, things changed on the New Year's Eve 2019, when WHO was alerted about a cluster of cases of pneumonia in a specific area within the city of Wuhan in Hubei province, China. Immediately, the thought went to a novel form of influenza virus, or some form of SARS that we saw back in 2003 and 4. Within 72 hours, these viruses were ruled out at the cause, and we knew that, and then knew that this is something new. Here in Niagara, obviously we keep, like I do keep up to date with these things. We do get these regular alerts. And our first meeting, I still remember, with our public health partners, it was on was around January 12th or 13th. And then we activated our emergency operations center here on January 27th. So, those details I won't go into too much right now. What we know about coronaviruses is they are a large group of viruses that have been around for years and years. The first identified coronavirus that we know about was in 1965, when it was isolated from a little boy with a common cold. And to this day, about 10 to 15% of common colds that we do see are actually due to different types of coronaviruses. They're very different than the coronaviruses we are going to talk about, but they do regularly occur. And it's called corona because it has these crown-like projections. So hence the name corona. Most of the coronaviruses, in fact, all of the coronaviruses are actually bat viruses. So bats have learned to live with a large number of coronaviruses in nature. They don't affect them, they don't cause any disease in bats. But every now and then, these viruses then spill over into human populations due to any number of reasons. And the most famous coronaviruses that we know about was the SARS virus in 2003 and 4 that did affect Toronto, downtown Toronto, quite a bit. And the still circulating Middle East respiratory syndrome coronavirus. This SARS coronavirus 2 likely originated from bats, and the spillover perhaps happened somewhere in summer or early fall of 2019. So we are almost heading into a year. Or this was circulating before and it got a chance to spread into human population. A lot of attention previously was given to the Hunan seafood market, which is a large seafood market in Hubei province. But again, the thought is this was not where this originated. This likely amplified with a large number of people in a small setting. We still don't know. Usually these viruses go from bats to an intermediate host or another animal, and then come into contact with the human beings. We still don't know what the intermediate host to this is yet, although there have been a lot of thoughts given about pangolins and such. What we do know is this particular SARS-CoV-2 can infect a lot of other animals, and in areas where there is a lot of this disease going around, there have been transmission from certain other animals, like, the most famous example was the two tigers in Brooklyn Zoo, I think. So this sort of completes the circle that way. Now, so the one question that we wanted to answer right away is, okay, what is this and how infectious is this thing? So this is likely more infectious or twice as more infectious than an influenza, but it is much less infectious than, let's say, measles, okay? Just to give you an example, in one person with COVID-19 can infect about 2 to 3 people if no control measures are in place. With measles, it's about 15 or 16 people that can be infected. And measles is the example of a truly an airborne virus that you can breathe in. So, we always like to give an example. If you aren't vaccinated against measles and you walk into a room where a patient with measles was there about 2 hours prior to your arrival, you will still likely contract this measles. So this is how infectious measles is. Just as a comparison, it's a very, very different virus than SARS-CoV-2. The incubation period that we hear about, and then, a lot of people hear about from public health is, okay, you're going to be at home in self-isolation for 14 days. It's because typically it can take as long as 14 days for symptoms to develop. Almost 90% of people develop disease at between day 5 to day 8, but we say 14 days to keep it consistent because the recall of when the exposure happened may be varied. So just to keep it consistent. And as you know, 80% or more just have a mild illness, and a small number of people go on to develop a severe disease. And unfortunately, this actually happens in our elderly folks. So transmission, there has been a lot said about this. And one thing we know is from numerous studies at this time, it doesn't happen because you touch something all the time, okay? It's mostly close contact and it's person to person where there is lack of physical distancing and there is a lack of masking in poorly ventilated areas. So by that, I mean close living quarters, things like that. And this has now become a concern for winter ahead. There was a lot initially thought about, I can get it from cardboard or groceries that I touch, but this does not seem to be the case in real life. Transmission really happens in close physical contact with lack of physical distancing and masking, and it's person to person for the most part. This is not to say there is no component of airborne or fine particles in the air, but that is limited to hospital settings where we do certain high risk procedures. When we are out in the community, that doesn't seem to play a big role at this time. So where do we stand now? I'm gonna take some time to go over a few graphs just to set the context and give us an idea. Overall, the darker the color, the higher the number of cases in this map. And so we can see United States, India, Brazil, Mexico, Argentina, South America seems to be a big driver of a large number of cases. And now Spain and also United Kingdom is starting to pick this up. This map is updated in real time by Johns Hopkins University, and this is as of last night. And we passed a grim milestone last night of 1 million deaths worldwide. By the time we are done with this talk, this would have changed. And but just to give us a context, 33.2 million people have been diagnosed with this now, and 1 million people that we know of have died, right? There are different ways to count the deceased. So this may this number may not be representative of the true nature of this. But suffice it to say, it is a mild illness for most people, but it's the most vulnerable in our population, the homeless, the elderly, long-term cares that bear the brunt of this disease. This is where we stand in Canada in terms of the total number of cases. So this includes people who have had it since they started and resolved. And it really is a tale of two provinces, so to speak here. And that's Ontario and Quebec driving most of the infections here in Canada. This just puts into context, like, we talked about flattening the curve. Yes, we did a good job initially, and now the number of cases are starting to rise. This is from Public Health Agency of Canada from last week, and they have already said that this epidemic is starting to accelerate nationally. So we are starting to see more and more cases at this time. The reproductive number of this virus is just a good estimate to say how this virus will do over time. If we look at the months of March to May and June, when we were in lockdown, we were able to keep things very low. And as things have opened up, there are more chances of this virus to spread, so for this epidemic to grow. Okay. So I hear a lot about this, that, okay, we have had cases, so what, right? Like, the deaths remain low. The issue here is this is a lagging indicator. So the number you will start seeing the rising numbers now, 6 to 8 weeks or sometimes 10 weeks down the road is when you would actually see hospitalizations and deaths starting to go up. The goal of all epidemic control measures is to prevent this. Because once hospitalizations increase, deaths increase, this is exactly, it defeats the purpose of what we have been trying to do. And this puts us in nice contact again with the Public Health Agency of Canada, that hospitalizations also lag behind, but now hospitalizations have started to increase, even in Canada, in Ontario, when we said things have been under control. So over the next 4 to 6 weeks would be a time where we have to buckle down and practice our bundled approach that I'll elaborate on. Nothing puts things into context more than when we talk about things locally here. And when I talk about this, I talk about us here in Niagara. We have had a total of 1,060 cases, and as we talk, the new numbers would be coming in. Vast majority of these cases have resolved now, but look at this, right? Like, so never forget the 64 Niagarans that actually lost their lives to this. So we, as we discuss this heading into the increasing number of cases, I always think back with my colleagues here who have been at the front lines, that this is something that gets as real as it gets. And I want to say, the only people for which this pandemic is truly over is the 64 Niagarans that did not make it through. Okay, so this is very much amongst us. This is just another graph from Niagara Regional Public Health, our colleagues there, where, again, we were able to control this. And now we are starting to see this creeping up at this time. So Niagara's curve was flat for the longest time, and we are already starting to see this a small upward trend. So why do I get so concerned about this? Is because this is 2 to 3 weeks behind. What's happening today, we will know about this in the next 2 to 3 weeks. And the way the trend is these numbers will increase. And this is not just a virus that infected people and killed them. This actually destroyed or had a big impact on a large number of people here in terms of our economy too. So look at the number. This is just, I am not an economist, but just to me, to my eye, looking at the number of people who lost their employment is tremendous. And we still haven't recovered to the baseline that we were before. And it may, now with all this happening again, this may go down. But again, just this put things in perspective, because we are talking about lives and livelihoods here. I'm not just talking about a disease that infects the lungs, right? So where are we going? A lot of attention has been given to the epidemiologic modeling. So there are mathematical models to predict. I am not one of the epidemiologists. I don't have the expertise in that, but as an infectious disease specialist, we can sort of think about and see how things are going over time. Now, it's obviously concerning that the numbers that we see every day are rising, but I want us to put this into context, okay? Back in March and April, when we tested people based on symptoms and travel, etc., before we opened up testing to everybody, essentially. And now, at that time, we were testing 5,000 to 10,000 samples every day in the labs. Now we are talking about 40,000 to 50,000. So yes, there is this thing where you test more, you find more, but I don't want us to forget the fact that at that time we were in a lockdown, right? So the chances of virus to spread at that time were much lower than they are now. So when we start testing more, when we open up, like you become the front line. The community sort of becomes the front line, and now most attention would be paid to healthcare capacity, because if healthcare capacity is overrun, then we are in deep trouble. Preventing waves, whenever we put control measures in place, it's always to make sure that there is this what's these little waves that we see. These are called a slow burn, as opposed to a large number of cases in a short interval of time, which can overburden the healthcare system. So looks like we may be heading into another wave now, or as our premier said, we are already into it. So what can we do? How do we get out of this? I would say, we are not talking about elimination of this virus anytime soon, okay? Countries like New Zealand that had 0 cases for a long time, as soon as we open up, we will see this, because there are more chances of the virus to spread. Going back to our bundled approach of trying to mitigate the risk, this is, there are no fancy drugs that have come up yet, although a couple have shown a lot of benefit. But for an average person on the street like me in the community, this is what makes the most impact. And that is the bundled approach of physical distancing, hand washing, masking, staying home if you're sick, making sure that you get tested if you have symptoms or if you have been directed by public health. Download the COVID-19 app, because this is the time when things are increasing, it would be most helpful. To control pandemics, to control these diseases, there has to be some biologic intervention. That means vaccines and contact tracing with the isolation of cases with aggressive testing. And this would really be needed, all of them in working together to make sure that we get control of this. But I would again say elimination is not it's not achievable, because it's spreading, and we should aim to control this. and have a slow burn, like Dr. Teresa Tam, our Chief Public Health Officer, had said. The other thing that Dr. Mustafa Hirji, our Medical Officer of Health, has said too, is the transmission that's being seen in Niagara is in expanded social bubbles, okay? These bubbles start bursting when the number of cases increase, right? And we have to be careful about who we interact with. And if we do interact, making sure we are physically distanced. You know, for the foreseeable future, as much as at work, we want to have that sense of camaraderie and, you know, sit and talk through our issues every day, there is going to be a lot of lonely lunches for the foreseeable future. You know, finding innovative ways like going on Zoom or other platforms to sort of enjoy things together, to watch a Raptors game, right? Like we have done that, Go Raptors, with this over Zoom is also something to consider. My colleagues in Hamilton and Toronto had this article out in National Post where they talked about the hammer. The hammer was when things were locked down, and the dance is what we are doing now, right? So public health interventions in specific areas where there is spread. I just hope we keep continuing with the dance to keep the numbers low, as opposed to coming down with a hammer. We know Quebec City and Montreal, they are going to be heading into the red zone over the next, I think, 24 hours or so. So vaccine, we talked about, there has been a lot of talk about vaccines. And this, I would really encourage you to keep an eye on this New York Times coronavirus vaccine tracker. Typically, vaccine requires 3 to 4 years of extensive research and study before it's even available to the public. But in the setting of pandemics, a lot of these things are accelerated. Doesn't mean the scientists choose unsafe vaccine. It just means they work over time. They make sure that these things are done in real time. So there are currently 0 approved vaccine for full use. There are 5 that have limited use that have been approved. And we know about some approved in China, in Russia. And there are 11 vaccines in advanced stages where they are being studied very closely. So last week, our Prime Minister did announce a deal with AstraZeneca and other companies and Pfizer, where certain doses of vaccines have been earmarked for us here. You know, I would just say the bottom line for vaccine is you can't put all the eggs in that basket. Even when a vaccine is available, the way things change, we may need to be, like for the foreseeable future, we will be masked, we would be physical distancing. This would be the new normal or the new way of life. I'm cautiously optimistic that we are going to get out of this, but it's not going to be realistically within the next few weeks or months or even a year, okay? There is a lot to be said about what's been out in the media and what has come out. There have been a lot of sources of misinformation and disinformation, and there are a lot of armchair experts that have become experts about coronavirus overnight and have you know, tried to peddle their unapproved treatments and all. I would just say, you know, like it's a personal choice, but I would stick to Public Health Agency of Canada, World Health Organization, Niagara Regional Public Health websites to look for this. And also we post regular updates at Niagara Health website. So, you know, I don't want to toot my own horn, but our own horn here, but that's important because these are things that are well researched, and you know, we pay a lot of attention to this. So we heard about, you know, the death rate is going down because the virus is mutating. Well, the truth behind this, the scientific fact behind this is every single virus mutates. all respiratory viruses have a very low fidelity or a very low threshold to mutate. That's why we see influenza circulating every year, okay? To date, as we talk today, there is no evidence that there is any mutation that has led this virus to become less deadly or more deadly, okay? But again, we are in the first year of this. And we cannot rely on this mutation piece to control what we can see. To control this, we still have to go back to the bundled approach of physical distancing, masking, and hand washing. To summarize quickly, draconian measures like lockdowns and the hammer, it's successful, but it's not sustainable. We can't live our lives like that. And a big fact here is that you can't control this disease in one part of the world and let the other part deal with it in their own way. None of us are going to be safe until all of us are safe. And again, going back to lots of misinformation out there, the infodemic. So looking at the trusted sources like WHO, Niagara Regional Public Health Agency of Canada, and Niagara Health for your source, just to find out how we are doing here in the community is important. Keep our guard up, practice the bundled approach, and make sure you don't forget the 64 of us in Niagara that lost their lives. We owe it to them. So with this, I want to end, and we would talk about questions. And
thank you so very much, Dr. Ali. We really appreciate actually your take on it. We appreciate it. We actually have received a number of comments actually from people who are attending here and participants, really appreciative of the data and the perspective that you have given to this crisis that we're facing right now. Over the next half hour, we're going to open it up to questions. So many of you actually have already provided us with some of the questions ahead of time. So we have about 8 to 10 we're trying to get to, but if you would like to ask some question, you have the chat function that is available to you, or otherwise, you also have the option of just raising your hand, and then you can speak directly and ask your question, and we will see it on our end and we'll respond to you. So thank you for that. But let's get started with some of the questions in an effort to get through as many as well we can. So Dr. Ali, when historians have been asked to comment on this pandemic, they're often referred to that less focus will be on the virus itself, but rather the biggest learning will come from how we responded to the situation. What kind of lesson will we learn from our response, in particular to when we look at shutdowns? Did we act appropriately to the risks that we faced? Or do you see, when we look back in years from now, what do you think? How do you think we will be judged for it?
So this is an amazing question, and I know all of us battle with this. So we're talking about the hammer, right? Like we're talking about, was the hammer really needed? There has been no known coronavirus pandemic known to mankind before. Okay, where we took the lessons from was the 1918 and 1919 influenza pandemic, okay? Where what we saw is when we didn't lock down properly, and in the fall, when the second wave of this started, it was actually much worse. And that's what our Premier Ford was referring to yesterday when he said, we are in a second wave, and this may be worse than what was before. I think we needed that. The history will look at us thinking that we needed to learn about this virus, okay? We needed to know what actually works. There were a lot of unknowns, and we weren't just fighting this virus, we were fighting the fear of unknown at that time. So to answer your question, I would say we actually needed at that time to learn, and now we know what works. What works is physical distancing, hand hygiene, and masking. So we learned that lesson, and let us not, let that go. This valuable lesson with so much sacrifice go to waste now.
I appreciate that perspective. The next question that has come in, it kind of ties together because it's looking at it and is asking, what is our end goal? Do we want to eradicate the virus? Are we looking at managing it? And you touched on it a little bit in your presentation, but is eradication realistic, or is it that we're actually looking at a strategy of containment that is more applicable in this situation in the long term?
Okay, so this is amazing. Again, a year-old virus that we know of, right? So eradication is not the goal. We did not, like, so I'll go back to an example of smallpox. When smallpox was eradicated from the world, it was because there was very effective WHO-led interventions where they isolated and quickly identified people with smallpox, and there was mass vaccination. To control or eliminate this is what would be needed, and we are far away from that at this time. Elimination is not the goal, controls are. Innovative thinking as to how we diagnose this early, how we control this early would be the key. And when these waves start, like, all attention then starts going to the healthcare system, because that is the most precious commodity, that is the most valuable asset we have. If healthcare system are overrun, we saw what happened in northern Italy, right? Like, so we Canadians are really, really good at learning from others' experiences and buckling up and responding to this. So I would say, yeah, we have to be very, very careful about, like, elimination in the immediate is not the goal. Control is.
No, and I think it's good for us to understand it and being prepared of what our future actually looks like too. One of the participants is asking the question, are there lessons for the public that we can learn from the response and how we responded to the 1918 flu pandemic when dealing with COVID-19? Is there something from that pandemic that we should keep in mind when looking at today's pandemic?
Yes, so that's, this is again, this is Grant asking this. Thank you, Grant. Okay, I would say what we learned from this 1918 pandemic was the second wave was actually much worse, because for better or for worse, right? Like, pandemic fatigue and alarm fatigue sets in. Okay, not to talk like an infectious disease doctor, but talking as a human being, I am tired of this. My family, my loved ones, my colleague, all of us are tired of this. But we have to keep in mind this virus is not tired. The lesson we learned in the 1918 influenza pandemic was that we actually had a much worse second wave at that time in the fall and winter, because people stopped wearing masks, physically distancing, and at that time we didn't even know as much about respiratory viruses. So I would say this is the time to start practicing our bundled approach and double down, reducing our social bubbles, etc.
Thank you. Another question for one of our participants has just come in, and they're asking for your view towards herd immunity. We, over the last couple of months, heard a lot about it, and we heard about it more in some countries than ours and in others, but what is your take on it?
So this, again, is too early to talk about herd immunity with this virus, okay? And I would just take a moment here to explain. Looking at studies from highly impacted areas like Italy, right? Like Spain, where what they did is there were times when there was a large number of people infected and a large number of deaths every day in those regions with hospital systems that were overrun. What they did after they controlled that wave is they went back and looked at antibodies, which are molecules that our bodies produce to control viruses, to see how much it has spread in the community. Okay, and what they found is consistently the number of individuals positive were antibodies. I think the number was somewhere between 1 to 10%. To control this, you need upwards of 70 to 80% of people to have antibodies to this virus. So we are not close. Herd immunity, like thinking about herd immunity at this point in time with this new virus, I think we would lose the opportunity to save a lot of our loved ones and save a lot of lives.
And that would be a high price to pay.
Yeah, that's not the price to pay for herd immunity.
Price to pay. You're absolutely right. One of the questions has come in light of your comments of saying that this is impacting often more vulnerable individuals, such as elderly in supportive housing units, people living in streets, low-income housing, addiction treatment facilities, jails and shelters. And this individual is asking, what are some of the Public Health Agency of Canada's best practices and guidelines for those individuals that are more vulnerable at this time?
So, I would say, like, working with Positive Living and Streetworks, like, it has opened my eyes that none of these diseases or talking about opioid crisis is it's not just a medical disease, it's a social disease, right? And I, as an infectious disease doctor within a hospital system, also see this, right? Like the impact it has on people. Testing with minimum symptoms, proper housing, things like that would go a long way. But I feel this is a bit beyond me to speculate about, and like proper authorities like public health and all would be the ones better suited to answer. But like what we do know, right, is that the numbers of opioid overdoses has also increased during this pandemic. So we can't just be blind to that. So I hear you.
Yeah. And this is, again, taking a look at how we're dealing with this pandemic. So over the weekend, I read a report that currently there are 2 Nobel Prize winning economists that on Saturday urged France to consider a 20-day lockdown. It's a planned lockdown. They basically suggested to France and saying, consider locking down from December 1st to the 20th so that families could actually celebrate their holidays. But at the same time, they looked at it and saying that if we're clear, uniform, and very transparent about the options, then it has actually less economic impact on us, and it has also less impact on the people most vulnerable. So where they're looking at and saying that if we want to, our gift buying and preparing for the season, we could do now, knowing that the lockdown is happening. The same we actually prepare for those individuals who are most vulnerable, instead of actually having it just suddenly come up and saying we're now in this self-isolation, we're in this lockdown situation as of tomorrow, as of next Monday. What are your thoughts on having actually scheduled, planned lockdowns so that the public, the community, the businesses and institutions can prepare for it?
So I would say, again, this is sort of beyond me, and it would be better directed towards the decision table that makes these decisions about lockdown. But what I would say, as an infectious disease doctor, is right now, as we stand today, you and I know what works. What works is physical distancing. What works is masking, hand hygiene, and what works is now starting to reduce our social bubbles. So, that would be my take on this. And I really want to avoid the hammer again.
That makes sense. Believe me, from our GNCC perspective, we feel the same about it. Yeah. And so do many businesses. This is a question from one of our participants, and they're asking and saying, say a vaccine is in place, is readily available to the public. What forecasts will there be on the uptake of it? And what if it isn't or doesn't have the uptake that we maybe expect that is there? And so I think this is it's a very interesting question because there's a lot of dialogue in the community about that. And what are your thoughts on it?
So, vaccine, just like all other vaccines, what we can't lose sight of is that, accelerated vaccine development, all the governments are working on this. They are making sure it's safe and it's efficacious, right? So, they're like we are very lucky here in Canada, and that there is no political interference about development of vaccines, etc. Okay, we let our scientists do their job to make sure we understand what it's going to take. But look, going back, right, the question that was asked about herd immunity, you know, if 60, 70 or upwards percent of people don't take this vaccine, then, you know, this is how we are going to be living. We are going to be physically distanced, masked up for you know, time to come. So this would really rely, you know, this would become an individual responsibility, just like influenza vaccine, right? Like, we know influenza virus mutates, it changes. But what we also know is influenza vaccine, it actually prevents complications. So getting the flu shot would be more important this year than any other year. It's important every year, but this year is especially more important because, again, going back, healthcare systems, you know, can be overburdened with this twin epidemic.
There are a lot of individuals who are anxious about the vaccine, and I can see it in some of the questions that have been also emailed to us, because one of the questions is that, say vaccine is in place, say we are comfortable with the uptake on it, when will people movement start again? When are people allowed to travel? And here's the second part to this one. This is our Ontario perspective, our Canadian perspective of it, but we travel worldwide. And what do you foresee when it comes to the vaccine, when we look at it on a worldwide perspective, and when it comes to people's ability to move again, to see loved ones, families, explore different places, which have been a normal pattern of most of our lives? What is your take on it? Give us a timeline, give us a sense of what we can expect.
Okay, if I have my say and if I have my wish, tomorrow. Everything is done tomorrow and we are good to go, but no. I would say, you know, realistically, look, you know, what Prime Minister Trudeau said, none of us are safe until all of us are safe. So, you know, making sure WHO, so World Health Organization, has the ability to actually reach far-flung places and make sure that the vaccine for lower and middle income countries is also the distribution and uptake of these vaccines is tightened up is very, very important. So until that happens, we are going to be very, very, we are going to be in a precarious situation with travel and all. Okay. I hope within the next 6 to 12 months, we have some good movement on the vaccine front. It only, like, it's just, I wish I can speculate and tell you the exact timeline. I want to, but I can't.
No, it makes sense. I listened to the World Health Organization. They indicated that the earliest time a vaccine is to be anticipated is almost by July of 2021. Was the time frame I think that they had released recently. And then after that, it's still, where is it available? How the countries and other countries responding to it? Is it a consistent vaccine or not? There are so many facets and so many questions.
Agreed.
It's a difficult one. This is a question from Emily Kovacs, who is asking, since getting the flu shot is more important now than ever for this year, as you just mentioned, what is Niagara Health's plan to create a public campaign on its importance, and how can we as community leaders actually support you and take a leadership role in getting the message out?
Okay. You know, the most important thing we can do is to listen to Dr. Hirji, Dr. Feller, and their teams in Niagara Regional Public Health to ensure that we, as a community, there is, you know, we do better than we did in the prior years in terms of taking this vaccine. You know, every year there is a flu campaign within the hospital for our employees, and you know, we make sure that we understand, we make sure, you know, this year it's going to be more important. But you know, I would say it's a Miss Emily Kovacs, like, we know now what to do, right? Like, let's not wait for the campaign. As soon as it's available, let's go get this done. Okay.
Yeah. Yeah, and I think there's a lot of opportunity that individuals can do in their own circle. Think about of
Yep.
their own circle of where you actually have some impact and can create some impact at the same time.
Yep.
Another question that has come forward, you have touched on it, but it's again, you had mentioned all viruses mutate. What are the risks of COVID 2.1, 3.0? Will they be more dangerous than what we have seen and are faced here right now with the knowledge that you have about the virus?
Okay, so about 3 or 4 weeks ago, I think it was Japan that reported an individual with a repeat infection with coronavirus. And then after that, there were more reports from Nevada, and there have been more reports again. And there are nuances to this, and I would try my best to explain. What they were doing is serial sampling of certain individuals, and they were doing these tests on people. They found for the longest time they remained negative, and then suddenly they became positive. So they took that virus and did very detailed molecular analysis, and what they found is previously in March and April when they were infected, and now in July or August when they were infected, these two viruses were different. But what was different at this time was this individual actually did not develop any signs or symptoms. Okay, so the thought is, yes, it did mutate, but in those individuals, again, in Nevada, also in Tokyo, this virus did not cause any clinical illness. Okay, that is reassuring, but at the same time, it's important to know that vaccine would become more important because, you know, things may change, or this virus, like it only time will tell, this virus then becomes like an influenza virus and circulates every year or every 2 years. So we'll just have to wait and see. But what is clear is don't wait for that to happen. Like, let's decrease the opportunity of this virus to transmit now, especially when influenza would be a concern.
I appreciate it. We're going back to the traveling. I think we have a few people who are anxious to travel and cross the border and borders that are there. And they're asking, because you are connected beyond Canada to a wider network, what will be the universal consensus about the approval of the vaccine?
So it would all be dependent on individual governments, okay? But, you know, there are nuances to this in the sense there are governments like ours that are fully supportive of WHO, where, you know, I can't be living in this small bubble where I get the vaccine, nobody else does. I think it's important people around us get the vaccine so we can move around, so to speak. So yeah, like only time will tell, but I think most of us do good. Most of us have this inherent ability to good, not just for ourselves, but for others around us. So I think it will appeal to this humanistic side in all of us at that time. I think Brad here just mentioned the numbers.
Yeah. He's asking, can you talk about the impact on the hospital from the annual flu? And if there isn't a high enough use of the flu vaccine in Niagara, what will happen at the local hospital if it has to cope with the flu plus a second wave of COVID-19? And that's a question from Grant just coming in.
Grant, okay. So look, I'll say we have our infection prevention and control measures in place, okay? We are ready. But again, the impact or the responsibility lies in the community. Like our president, Ms. Lynn Guerrero has said, we need this unwavering support from our community to ensure that we just went to 100% of our capabilities back to doing surgeries, etc., to make sure that we continue that way, okay? You know, our communications team, etc., like with us, like we will all be involved in making sure the message gets out. I don't want to downplay the influenza piece, but I would say this, right, like Grant, like looking at the data from Australia, looking at the data from the Southern Hemisphere, thankfully, the data about influenza has been reassuring. But again, the thing is, those places were in actual, like they had some more draconian measures in place than we did. So that also has to be taken into account. The measures that we talk about, the bundled approach, also works for all other respiratory, for most respiratory viruses at this time.
I appreciate that. One of the purposes of our GNCC Espresso Live series that we've run over the last 6 months is our ability kind of to asking ourselves to stretch our minds into the future. Not only what does tomorrow look like or next week, but rather months and years to come. If there is one lesson that we need to take on in understanding this pandemic, what do you think it is?
This pandemic has brought out the best in us. Okay, most of us, it has brought out the best in us. It has shown the resilience in our communities, in our hospital systems, and the ultimate sacrifice that 64 Niagara residents gave. Okay, I would say one thing, if I have to say, for the foreseeable future, let's put our guard up. Don't let this all sacrifice go to waste. And I would, again, your broken record here in Niagara, I would say, let's go back to the bundled approach. Make sure we physically distance, we mask, and we do proper hand hygiene, get the flu shot, reducing social bubbles, because this is exactly what we can do today now.
Thank you very much. We are 4 minutes before the end of our webinar, and what we usually ask is the panelists to provide us with a minute or two of closing comments. So, Dr. Ali, what are your closing comments for the panelists and the people who will see this webinar in the days to come?
I would say don't hesitate and reach out and ask questions. I know we all have this fear of the unknown, but we are in a much better position than we were in March, right? At that time, we did not know how this is going to impact, what can I do as an individual to help the community at large. This is the time where an individual choice, an individual approach to safety can have a larger impact on our community. So, just a small number of us can do a lot of good for the betterment of our community. So that would be very important to make sure we keep our economy going, we keep ourselves and our loved ones safe.
Yeah. Really, on behalf of the GNCC, on behalf of all the participants today, Dr. Ali, thank you so very much for being with us this morning. We loved the presentation. It was data-driven, evidence-based, and we really appreciate the dialogue, and especially with you putting a light on each in our individual contributions to this pandemic and in this pandemic, and ensuring that we're actually moving through it as well as we can. So thank you so very much. And to all the participants, thank you so very much for being with us today. Today's webinar has been made possible by TD of Niagara, and it is also being recorded and will be available on our website at gncc.ca, as well as it will be emailed to all of the participants and made available through our social media channels in the upcoming days. If you have any questions or further questions, please always feel free to check in with us. And we hope to direct you to the information that is going to make it easier as we're moving through this. Again, thank you for being here this morning, and I wish all of you a wonderful day. Thank you.
Thank you.
Thank you.